World Down Syndrome Day. World Down Syndrome Day on March 21st gives people with Down syndrome and their advocates a voice and an opportunity to be heard. We produce 5 amazing videos per week, so click on the like button and subscribe to see future videos. Like, comment, share, subscribe. The goal is to educate others on the importance of supporting our friends and family who have directly and indirectly experienced life with Down syndrome. Down syndrome is a naturally occurring chromosomal arrangement that has always been a part of the human condition. It's a day where we assemble and organize activities to promote public awareness for the genetic disorder. It exists in all regions globally and commonly affects learning styles, physical characteristics, and overall health. In order to ensure proper growth and development, social learning programs support and integrate with anyone who has Down syndrome. Every year, their voices grow louder and they influence government policy, becoming more empowered. Through events around the world, people with Down syndrome can ensure their own advocacy and be included in their communities. What is Down syndrome? Down syndrome is a condition in which a person has an extra chromosome. Typically, a baby is born with 46 chromosomes. Babies with Down syndrome have an extra chromosome of one of these chromosomes, chromosome 21. The medical term for having an extra copy of a chromosome is trisomy. Down syndrome is also referred to as trisomy 21. This extra copy changes how the baby's body and brain develop, which can cause both mental and physical challenges for the baby. Some common physical features of Down syndrome include a flattened face, especially the bridge of the nose, almond-shaped eyes that slant up, a short neck, small ears, a tongue that tends to stick out of the mouth, tiny white spots on the iris of the eye, small hands and feet, a single line across the palm of the hand, small pinky fingers that sometimes curve toward the thumb, poor muscle tone or loose joints, shorter in height as children and adults. Types of Down syndrome. Trisomy 21. About 95% of people with Down syndrome have trisomy 21. With this type of Down syndrome, each cell in the body has 3 separate copies of chromosome 21 instead of the usual 2 copies. Translocation Down syndrome. This type accounts for a small percentage of people with Down syndrome, about 3%. This occurs when an extra part or a whole extra chromosome 21 is present, but it is attached or translocated to a different chromosome rather than being a separate chromosome 21. Mosaic Down syndrome. This type affects about 2% of people with Down syndrome. Mosaic means mixture or combination. For children with mosaic Down syndrome, some of their cells have 3 copies of chromosome 21, but other cells have the typical 2 copies of chromosome 21. Children with mosaic Down syndrome may have the same features as other children with Down syndrome. However, they may have fewer features of the condition due to the presence of some or many cells with a typical number of chromosomes. Causes and risk factors. The extra chromosome 21 leads to physical features and developmental challenges that can occur among people with Down syndrome. Researchers know that Down syndrome is caused by an extra chromosome. but no one knows for sure why Down syndrome occurs or how many different factors play a role. One factor that increases the risk for having a baby with Down syndrome is the mother's age. Women who are 35 years or older when they become pregnant are more likely to have a pregnancy affected by Down syndrome than women who become pregnant at a younger age. However, the majority of babies with Down syndrome are born to mothers less than 35 years old because there are many more births among younger women. Diagnosis. A screening test can tell a woman and her healthcare provider whether her pregnancy has a lower or higher chance of having Down syndrome. Screening tests do not provide an absolute diagnosis, but they are safer for the mother and the developing baby. Diagnostic tests can typically detect whether or not a baby will have Down syndrome, but they can be more risky for the mother and developing baby. Neither screening nor diagnostic tests can predict the full impact of Down syndrome on a baby. No one can predict this. Treatments. Down syndrome is a lifelong condition. Services early in life will often help babies and children with Down syndrome to improve their physical and intellectual abilities. Most of these services focus on helping children with Down syndrome develop to their full potential.